Welcome back to Emerging Infectious Disease videos for pre-hospital providers. Module 2 in this program will cover basic infection control concepts such as modes of transmission and how to recognize an infectious patient in the field. This instructional series was created by the University of Maryland, Baltimore County Department of Emergency Health Services with assistance from the Maryland Department of Health, the Maryland Institute for Emergency Medical Services Systems, and funding from the U.S. Centers for Disease Control and Prevention. In Module 2, we will learn about how infections pass from human to human or animal to human, often called the chain of infection. We will pay particular attention to how disease transmission relates to pre-hospital providers and how infections are spread in the field. When finished with this module, you will be able to describe the difference between contact, droplet, and airborne modes of disease transmission. We will describe techniques to recognize infectious patients in the pre-hospital environment using patient presentation, travel history, and symptoms. We will also introduce the concept of the multi-pathogen approach to infectious patients. This approach will help you to take the necessary personal safety precautions based on initial patient assessment even before any pathogen is identified. This is crucial, given that, in the field, you are unlikely to have the ability to determine exactly which virus or bacteria your patient may have contracted. To begin, let's start with some of the basic vocabulary so that we understand words to mean the same thing. A pathogen is a small organism that can cause disease. Emerging infectious diseases, or EIDs, are diseases which have recently developed in a population or have previously existed but are rapidly increasing in incidence or geographic range. An agent is another term used to describe a pathogen. A host or reservoir is where one would expect to find colonies or populations of the microbes. Animal or human hosts are capable of spreading microbes as they move around and interact with other humans or animals. A portal of exit or a portal of entry is the pathway by which microbes can enter or exit a host. Some portals are easy to recognize, such as the airway, mouth, and urinary tract. Once we know where the portals of entry and exit are, we also need to understand how microbes spread from one host to another. This is called the mode of transmission. We will see that transmission can be direct, from one host to a new one, or indirect, when microbes are left on non-living objects, such as door handles or oxygen bottle valves, and then picked up by other potential hosts. Personal protective equipment, or PPE, includes protective gloves, masks, glasses, and gowns that help minimize the spread of microbes from person to person. First, we will cover the chain of infection in the pre-hospital environment. The chain of infection is a term used to describe the steps required for an infectious disease to spread from one person to another. Understanding the way infectious pathogens spread allows us to intervene and prevent transmission from occurring between patients and pre-hospital providers or between us and our colleagues or families. The chain of infection involves the interaction of an infectious agent, a susceptible host or reservoir, and the environments in which we live and work. The infectious agent is the pathogen in question, commonly a bacteria or virus. The reservoir is the habitat in which an infectious agent lives. This reservoir may include humans, animals, insects, or the environment. The environment includes all the places where we live and work. The reservoir may or may not be the source of infection. An infectious agent can be transmitted from its natural reservoir to a susceptible host by varying routes. Modes of transmission include direct contact, droplet, airborne, vehicle, or vector-borne. Vector-borne transmission means that the microbe is spread from one host to another by an intermediate force, which can be living or non-living. For example, both mosquitoes and doorknobs can transmit pathogens from one person to another without being made ill by the microbes. The doorknobs and mosquitoes serve as vectors. The spread of the influenza virus from one person to another is an example of the chain of infection in action. Influenza transmission occurs when the influenza virus, the infectious agent, lives and grows in a person's lungs and air passages. This person is also called the reservoir. The virus exits the respiratory tract, the portal of exit, through coughing or sneezing and travels via droplet transmission through the air. Contact transmission then occurs via hands or touching contaminated surfaces to a susceptible host. A typical flu virus can live on the skin for 15 minutes and surfaces for as long as 24 hours. Once the virus has entered a new host, it begins to multiply and cause disease. When the new host coughs or sneezes, the chain of infection begins again. Pre-hospital providers may be either a host or reservoir for the influenza virus. They may become infected with the flu from patients or transmit their own flu virus to others, including family, colleagues, and other patients. Providers may spread disease from patient to patient through incorrect use and disposal of PPE, such as wearing dirty gloves while driving or opening doors. Providers may also transmit an infectious disease that they are infected with, such as a cold or flu, to their patients. If you are ill or have a fever, you should avoid contact with patients until you consult occupational health or a medical provider in conjunction with your local protocols. In general, providers who have fever, diarrhea, conjunctivitis, or open sores should avoid direct patient contact. Pre-hospital providers and their equipment can spread infection from one patient to another if appropriate precautions are not taken. Ambulances and ambulance equipment that are not adequately disinfected after transporting a patient with an infectious disease may serve as a mode of disease transmission or vector. Equipment may serve to transmit the flu virus for up to 1 day if the surfaces that have been exposed to flu droplets are not appropriately decontaminated. Research indicates that it is common for ambulances to have a variety of infectious pathogens on interior surfaces, including equipment like oxygen bottle valves, radios, and exterior surfaces like door handles. Pre-hospital providers may also be exposed to infectious diseases and become infected while performing patient care. It is important to be aware of the modes of disease transmission and how to take appropriate precautions. Pre-hospital providers can disrupt the chain of infection and prevent the spread of disease. Awareness of the modes of disease transmission and methods of prevention are key to breaking the chain of infection. Providers should be vaccinated against measles, mumps, rubella, and hepatitis B prior to employment in conjunction with the policies within their jurisdiction. When pre-hospital providers feel ill, have a fever, vomiting, or diarrhea, they should not enter the work environment and should follow the occupational health policies in their jurisdiction. In addition, any provider with a potentially infectious cough should wear a surgical mask at all times. Providers should wash their hands with soap and water before and after calls whenever possible. When soap and water are not available, alcohol-based hand sanitizer should be used. Proper personal protective equipment should be used to prevent transmission of disease from patient to providers. After the call, all equipment that may have been exposed to blood, bodily fluids, or droplets should be cleaned and disinfected. Remember that patients do not need to touch equipment in order to leave pathogens on the equipment or ambulance surfaces. If exposure to blood products is suspected, post-exposure prophylaxis should be pursued per your jurisdictional protocols.
Medic 4, respond for a 35-year-old male, sick patient with a fever.
Dispatch Medic 4 en route.
Copy, Medic 4 en route.
Medic 4 on scene.
Medic 4 on scene.
Direct contact disease transmission occurs when microbes are transferred directly from one infected person to a healthy individual. Opportunities for direct contact transmission may occur between patients and healthcare personnel through direct exposure to a patient's blood or other blood-containing bodily fluids, which may enter a caregiver's body through contact with a mucous membrane or breaks in the skin, such as cuts or abrasions. Direct contact can happen through skin-to-skin contact, kissing, and sexual intercourse. Direct contact also refers to contact with soil or vegetation that can carry infection. Examples of pathogens that spread through direct contact may include C. diff or multi-drug-resistant Staph aureus, also known as MRSA. Indirect contact occurs through touching contaminated objects that transfer the pathogen to a new susceptible host. This may occur through unprotected contact with patient care devices such as oxygen tanks, cardiac monitors, or stretcher handles that are not cleaned between patients. Uniforms or personal protective equipment may also become contaminated with pathogens. Examples of pathogens that spread through indirect contact may include influenza and hepatitis C.
EMF.
Providers should ask about the following symptoms during the initial doorway assessment: cough, fever, vomiting, diarrhea, rash, and travel history or hospitalizations outside of the U.S. in the last 6 months.
Thanks for coming. My dad's not feeling well. I think he has a fever.
Okay, before we come in, can you tell us if your dad has a cough or any vomiting?
No, just a really bad rash on his leg. It looks like the last time he got MRSA.
Okay, with the history of MRSA, we should probably gown up.
Joseph with him?
Mm-hmm. Thanks for coming. My leg hurts really bad, and I've been running a fever since last night.
I have to check you out a little bit, get some vital signs.
Mm-hmm.
Have you been seen for this, long-term, short-term?
This feels a lot like the last time I had MRSA.
How long ago was that?
That was about a year and a half ago.
Okay. And no problem since then?
No,
Okay.
This is just, yeah.
Yeah, we're just going to be doing a couple of things real fast, okay?
Mm-hmm.
Besides the leg pain and the rash there, is there any rash anywhere else? Any pain anywhere else?
Not that I've seen, no.
Okay. No difficulty breathing?
Nope.
Okay. No chest pain?
No.
Okay. All right. And have you taken any medications for it?
Just some aspirin.
Okay. How long ago did you take that?
About an hour or two.
Okay. Do you have any other medical conditions?
No.
Okay.
No, good.
Good. And any medication allergies?
No.
Okay. Perfect.
118, 82.
Okay. Have a heart rate of 96. All right. We're going to get you loaded up on our stretcher, get you to the ambulance, and we'll get you to the hospital and get this checked out, okay?
Okay, thanks.
All right. We will now view a scene where droplet transmission is occurring.
Medic 4, respond for a 30-year-old female, sick patient with shortness of breath and a fever.
Dispatch Medic 4 en route.
Copy, Medic 4 en route.
EMF.
Oh, thank goodness you're here. My roommate, she's been having a lot of trouble breathing. Please help.
Okay. Before we come in, can you tell us if your roommate has a fever?
I think she's just having some chills, that's all.
Okay.
Yeah.
All right. Let's put on masks before we go in.
Yes.
All right. Do you know how long it's been going on?
For almost an hour.
Okay. Yeah. All right. In this scene, the providers are using surgical masks and goggles to protect against droplet transmission from this patient with shortness of breath and a fever. Some diseases are spread through the respiratory secretions that are produced when a person talks, coughs, or sneezes. This mode of transmission is called droplet transmission. When an infected person coughs or sneezes, the disease they are carrying can travel on the released particles. Generally, droplet transmission occurs over a few feet before the droplets fall to the ground or other surfaces.
What's going on today?
I'm having a hard time breathing, and I think I had a fever last night.
Okay. Do you have a history of this kind of stuff? Do you have asthma, chronic lung problem?
You want to take a listen to your lungs? I'll get some other vital signs started.
Every time I put the stethoscope down, take a deep breath. Good job. Diffuse breathing in all fields.
Okay. All right. Well, in that case, let's start a neb treatment, and let's change our mask to the N95s, okay?
Check.
As the mode of transmission changes from droplet to airborne, your level of precautions must also increase. Airborne transmission occurs when an infected person coughs or sneezes, releasing droplets which evaporate and leave the infectious agent suspended in the air. These agents can then be spread long distances by air currents on very small particles like dust. Some examples of pathogens that spread through airborne transmission include tuberculosis and measles, as well as weaponized pathogens such as anthrax. It is important for pre-hospital providers to be aware that providing nebulizer treatments to patients with the flu results in the flu virus becoming transmitted by airborne methods rather than droplet methods.
All right, ma'am, have you ever been giving a neb treatment before?
Yes.
Okay, all right, we're gonna do that, and we are going to just change out our masks for this treatment. So just give us 1 second, okay? Do you have any medication allergies?
Not that I know of.
And you have had a neb treatment before, right?
Yes.
Are you prescribed albuterol?
No.
And you don't regularly take an inhaler?
No.
Okay. All right. I'm going to give you a duo neb, so albuterol and ipratropium, okay?
Okay.
And it should help that trouble breathing. All right, so I'm going to put this around your face. Just take a couple deep breaths, okay?
108.72.
All right, you want to hold that for me? 108.72? All right, I'm just going to feel your pulse, okay? All right, now that we got that neb treatment started, why don't we get you on the stretcher and we'll get you to the hospital and get this checked out, okay?
Vehicle transmission occurs when non-living objects like water, food, bedding, or medical supplies becomes contaminated with an infectious agent and spreads the pathogen to new susceptible hosts. Vehicles can simply carry an infectious agent, or they may provide an environment in which the agent grows, multiplies, or produces toxins. For example, improperly canned foods provide an environment that supports the production of botulinum toxin by Clostridium botulinum bacteria, and when ingested by humans, results in botulism. Vector transmission occurs when living organisms such as mosquitoes, ticks, and fleas transmit infectious agents between humans or from animals to humans. Mosquitoes are the most well-known vector of microbe-causing diseases, such as malaria, dengue fever, West Nile virus, and Zika virus. Animal bites can be another vector of diseases, such as rabies. We will now discuss methods to recognize infectious patients and using the multi-pathogen approach. The multi-pathogen approach is the process by which a healthcare provider uses patient history and presentation to determine the most likely mode of infectious disease transmission and the level of personal protective equipment needed. This is performed without knowing the specific pathogen. Don't hesitate to call medical control regarding recommended levels of PPE for patient care. So what does an infectious patient look like? Any patient with cough, fever, rash, vomiting, bleeding, or diarrhea should be considered contagious. Patients should also be asked if they have traveled outside of the U.S. in the last 30 days. After you've recognized that a patient is likely infectious, you'll need to determine possible modes of transmission, such as contact, droplet, or airborne, and choose which level of PPE is appropriate to protect yourself. Regardless of the dispatch chief complaint, pre-hospital personnel should be vigilant for signs and symptoms of infectious disease. During times of suspicion for high-consequence diseases like Ebola virus disease, pre-hospital personnel may be required to ask additional screening questions such as travel and exposure history. In general, providers should avoid any direct exposure to blood or bodily fluids. The multi-pathogen approach is a tool for pre-hospital providers to determine the most appropriate level of PPE based upon a patient's presenting signs and symptoms. For example, providers treating patients with cough and fever should use droplet precautions. However, during times when the spread of viruses are known to increase or change, such as with novel flu, providers should consider using special respiratory precautions. Wearing the appropriate level of precaution will ensure that you are protecting yourself, your patients, and your community. Thank you for joining us. There are additional resources in the slides below for your review. In our next module, we will cover the different levels of PPE and discuss more about when to use them.